Welcome! You're tuning in to Candid Conversations with Women in Surgery from Connecticut Children's, a premier regional pediatric healthcare system. Topics can range from emerging research to career advice to the unique challenges female surgeons face when breaking into a male-dominated field.
Hello, I'm Lisa Morella, Director of Organizational Effectiveness and Learning at Connecticut Children's. In my role as a dedicated resource to our physicians and advanced practice providers, I have the pleasure of joining you as the host of the Women in Surgery podcast. Joining us today are...
I'll start off. I'm Kristen Pierz. I'm a pediatric orthopedic surgeon and associate professor, having joined Connecticut Children's and the University of Connecticut in 2001. My interests in orthopedics are gait analysis, neuromuscular disorders, and limb deformity. I have two children, a 20-year-old and a 16-year-old son, and a terrific husband. And I enjoy soccer as my main hobby, spinning and doing this.
So hi, I'm Courtney Rowe. I am a pediatric urologist, and I've been at Connecticut Children's for 2 years, right out of fellowship. I have 3 daughters, ages 9, 7, and 3, and a great husband who is kind of like the primary parent and does all the good cooking and cleaning, and also happens to hold down a fantastic job. My interests in pediatric urology are reconstructive surgery, and I am a researcher in translational research looking at how to use translational research and reconstructive medicine to improve urologic outcomes. And I guess in my spare time, I do some gardening and just finished setting up a hydroponic system for some lettuce during the pandemic.
Hi, my name is Raina. I'm a congenital heart surgeon here at Connecticut Children's. I've been here for just under a year, since February of 2020. I'm an assistant professor at University of Connecticut School of Medicine. And besides operating on patients anywhere from neonates, like today's patient who is a 3 kilo, 1 week old, to adults with congenital heart disease, I try to find time to catch up on sleep, take care of my kids, and do some research on the side based on outcomes research.
Hi, my name is Kavanagh. I am a pediatric otolaryngologist at Connecticut Children's. I've been here for 10 years. I am an associate professor and director of simulation for the University of Connecticut Otolaryngology residency program. And I also co-direct the wellness program for the residents. I have 5 kids. They are 16, 13, 10, 6, and 4. 1 girl, 4 boys. And they keep me pretty busy.
Hi, I am Kristan Finck. I am the Executive Vice President and Surgeon-in-Chief at Connecticut Children's Medical Center. I'm the professor at University of Connecticut, and I specialize in pediatric general and thoracic surgery. I'm also a wife and a mother of 3. I love my dogs and John Bon Jovi. Things that I'm interested in are tissue engineering, esophageal tissue reconstruction, lung tissue engineering, and how any of these regenerative technologies can be used as novel therapies for the diseases that face our neonates. My children's ages are 15, 12, and 9. The 9-year-old still believes in Christmas, so I'm hoping to have at least one more Christmas where we have a believer.
Nice. Thank you. So today's topic is sponsorship versus mentorship. Too few women are reaching the top of their organizations, and a big reason is that they are not getting the high-stakes assignment that are prerequisites for a shot at the C-suite. Often, this is due to lack of powerful, and often that means male, sponsors, demanding and ensuring that they get these stepping stone jobs. We're going to hear some words of wisdom from our women in surgery. Let's learn more about how they operate. Okay, so let's start off with a broad question about mentors and sponsors. Mentors and sponsors are different. Sponsorship is a kind of helping relationship in which a senior and more powerful people use their personal clout to advocate for and to place a more junior person in a key role. While mentoring someone is really more about sharing their knowledge and sharing their expertise. A sponsor is a person who has power and will use that power for you. Women tend to have been over-mentored and under-sponsored. And so I'd love to turn to you and say, how has that played out for you? What have you seen or experienced in terms of mentorship and sponsorship?
I think over the years in my career, I have noticed a clear difference in the way we have gone through not only medical education, but internship and residency, where the males that were in my general surgery program definitely had a mentor that they aligned with that was responsible for talking to them about their careers and where they should go. Whereas because there were so few women in our program, we kind of were left to our own. I noticed more that the males in the program would get put on strategic committees, get promoted to certain things, or get asked to do certain tasks, where the women didn't tend to have those opportunities. And I think that that's the clear difference between some of the mentorship and sponsorship that I noticed between males and females. I don't know, Courtney, did you notice anything?
Yeah, I think like general surgery, urology is a very male-dominated specialty. And I think that a lot of the relationships that are built have typically been male and male relationships. And so I think, a lot of the activities were very male dominated activities, and a lot of the things that people would do to bond and spend time together were mostly appropriate for males. What I found interesting as I've kind of transitioned into pediatric urology is that some of the dynamic that was awkward with some of the male potential mentors that I encountered along the way really went away as the culture shifted to the pediatric focus. And I wonder, if that's whether in a lot of these specialties, a lot more women are going into pediatric specialties, not necessarily because it's a quote unquote softer field, but mostly because the mentors that you meet may be more open to mentoring women. I'll say that while I had some great adult urology mentors, the pediatric urology mentors that I met were much more willing to sponsor me. And I think that in the way Lisa kind of talked about that difference between mentorship and sponsorship, I too have struggled with that. I found it fairly easy to ask people to be my mentors, both in formal and informal ways, but asking for sponsorship is hard.
And Courtney, what makes it hard to ask for? Because as we discussed, that sponsorship is really asking a person with clout to use that clout for your, for your promotion or your putting you forward. What makes it hard for, and I actually will ask that for all of you, what makes it hard to ask for sponsorship?
I can speak from the field of congenital cardiac surgery in the sense that it crosses the spectrum of pediatric and adults. Again, like a lot of the other specialists in the group today, we all started out in general surgery or some version of adult surgical training programs, and then potentially moved into the pediatric side of it. In my field, specifically with cardiac surgery, we go through 2 general surgery residencies followed by thoracic surgery and then congenital. And in fact, the number of women as we go through each level continues to go down. And thanks to Dr. Finck's generous thought process and idea that she helped promote when I began, I started researching how many female congenital cardiac surgeons there are. And we're actually starting a research project based on this now. And I just received IRB approval for it, that there are only about somewhere 20 to 25 practicing in the entire country, whereas the field itself has over 500 surgeons. And ever since the American Board of Thoracic Surgery was founded over 70 years ago, only actually less than 3% of those boarded are women. So in my field, it's not that being in the pediatric side has made it easier. And I've actually thought opposite of what Courtney's experiences were, that it's been harder to ask for that sponsorship because you feel competitive with your male peers, and they have a lot of innate bonds that have been formed from their earlier time periods, that it's been a tough circle to penetrate to get to that inner circle. Plus, depending on each of our specialties, the stakes could be different. And again, speaking to mine, we have our public reporting system that makes our specialty very difficult to navigate in the first 10 years. And so not just mentorship, sponsorship is key in our field, because if a senior surgeon does not guide our career properly, not only could we have potentially bad patient outcomes, but it can be disastrous for our career.
I have one question for you, Raina. The senior surgeon here, Dr. Mello, did seem to take on sort of a mentorship role for you. How did that, because I know you've come to my office a couple times to talk about how awkward sometimes that could have been, or awkward may be the wrong word, but uncomfortable, and you were surprised. Why were you surprised?
Yeah, you're right. Dr. Mello has taken on a great mentorship and a senior surgeon role for me, but I am surprised because he would be really only the second surgeon that I've come across to do that. Again, I'm not sure if it's the political capital, the risk involved from a senior's perspective that they have to invest in a junior's career to really elevate them, to get them to a certain level. But it's not just a matter of skill, because we all go through our lengthy training processes. After medical school, we've all gone through double-digit number of years of postgraduate training. So we all have a certain level of basic skill that needs for us to get us to our current position. But still, if you don't have the opportunity to make those decisions, to do those surgeries, and then if there's any negative outcomes, to be shielded from that, from any repercussions early on, you lose your confidence. You lose your ability to navigate through the process, critical decision making. And yeah, I've been very glad to work with Dr. Mello, because not only just today we were talking about, we operated on a patient that now that we've done certain kind of cases, he feels comfortable that, that he would trust me to now do that for the next case. And that kind of trust, that bond takes a long time to build.
Can I ask people's thoughts, especially people who've been doing this more, about the social dynamic? Because when I think about going through training and residency and, shifting from adult to pediatric, I can remember vividly this one lunch that one of the adult urologists took me out for. And this was like a classic thing on this particular rotation in this particular role in this particular hospital, was that he took the resident out and they had a lunch at the end of the rotation and they chatted. And I remember after, it was a fine lunch and, it went well and stuff. And I came home afterwards and I said to my husband, it's really awkward. There we are, here, older man, younger woman sitting out at this park. And I said, it was fine. He didn't say anything or do anything inappropriate, but the whole thing just felt awkward. I wonder if that's, just me reading into it. My husband said, I have a lot of lunches with a lot of junior women and they're not awkward. That's not you. It's just, it was something about that situation was set up in a way that made you feel inappropriate about it. And, whether this person meant to or didn't, it's true. There are a lot of people out there who are senior males mentoring or sponsoring junior females who don't make that awkward. And yet on the flip side, there have been a lot of interactions I've had or seen others had that were awkward and that raise a lot of questions. And I'm curious, does that get better as you move along in your career? Is there always sort of this undercurrent of something potentially inappropriate happening when you have these one-on-one interactions? I mean, we all read about Mike Pence being unwilling to take a lunch meeting with a female. And, how can you possibly get ahead in your career if that is always the assumption?
Yeah, I think fortunately that despite orthopedics being a very male-dominated field, it has been the minority of my interactions, but when they occur, they really stand out. And I remember when you think about mentors versus sponsors, mentors trying to help you along and be your friend, but maybe not rising your career, lifting you or really helping to promote you. But I distinctly remember one very well-meaning surgeon who would always feel like he's on my side, and he would preface most conversations with, because I have daughters, I understand. It's like, why does he, what? I don't know his daughters. They may be wonderful, they may not be, but it was like this trying to bond with me. I'm like, okay. And he was always trying, I want to help you succeed in orthopedics and do things. And I'm going, okay, I have other people that are helping me along. It was awkward, but it was totally in a well-meaning way. He was, trying to put me in situations that would help me along, but it's like, must you preface it with, I understand because I have daughters? Just
well, I guess the question becomes, would he say I have sons? And
no, of course.
Yeah.
But it was, it was a unique situation where I was, the only woman in the program, and he must have felt it was difficult for me and therefore was going to try to help me along, when in reality it wasn't. And the folks that really rise in my mind were the folks who really did help put me on the path of what I wanted to do, understood what my desires were, not necessarily what their daughters' desires were, which would have nothing to do with me. And those people really stand out as the ones that did help.
So listening to what Kristan just said and Courtney talking about the awkwardness, I'd like to ask each of you to think about, we have males listening, we have male surgeons and physicians. How can we coach them to give them some pointers or ideas on how to lower that awkwardness so they feel comfortable and confident to not just mentor earlier in career women in surgery, but sponsor them, use their clout to advance your career? How can we help them feel more comfortable? And not that it's our job, but let's give them some pointers.
The extreme, I was counteracting the another example of an individual who had such power is, I think, treating the individual for what they're doing. If they're a surgeon and their goals are surgical, emphasize those things. It's not personal. If you need to understand someone's personality to help work with them, but it's a career and a job sort of focus, and not you're the woman in the field and being mentored by someone else. And I have the opposite kind of polar experience was when I was a fellow, and my fellowship director told me he wants me to go and present his research somewhere. It wasn't my research. I was just coming on board, but he needed this presented and he couldn't go. So I'm going to go to this meeting to present his research. And I was coming down with a cold, and he took me by the arm. He heard me sneeze or something in his office. He goes, "You can't get sick for this. You need to be there. You need to be in top shape." He took me by the arm, walked me down to the ENT clinic, said, she needs something like clear her sinuses and get her on this plane, and she needs to be there. And it was like that. He takes control of the situation in both of our interests. He wanted me to do well. He wanted his research presented. It was a great sponsor. This wasn't a nice mentor being nice that we could communicate with. It was an empowering moment. And the fact that he could just walk in, he commanded the authority in another department. He was a chair of a department. And seeing that, I'm like, not only do I really respect this man, he helped get both of us what we wanted, but I no longer want to let him down, right? Now he's sponsoring me, and I better do well. He's putting me up on a pedestal, and I'm going to have to shine, which helps you grow. And so it's really going for the job and the career, and the not be nice to the person and try to, belittle or patronize, try to lay off patronization.
Yeah. Kristan, you brought up a great point. And the point that you just talked about is one of the ways it might make it easier for us to ask for sponsorship is if we think about it more as a symbiotic relationship rather than somebody doing the early in career or earlier in career person a favor. Because there is literature says that a protege and sponsor relationship is symbiotic, because by you shining, the example Kristan just gave, by her shining, she's also advancing the career of the person who is sponsoring her. So if we think about it more symbiotically rather than somebody doing us a favor, it may feel like something we can take more control over. So I want to open it up to you and to the group and ask you, what are your thoughts about thinking about this more as a symbiotic relationship rather than somebody bestowing a favor upon you?
Yeah, I think to Kristen's point that if you focus it on the skills, if you make it gender neutral, it doesn't have to be whether you're a male or a female to gain the sponsorship of a senior surgeon. It should be, in an ideal world, it's based on your skill level. At a certain point, if you have those skills, if you have those capabilities, and then on top of it, if you have the motivation and you're interested to climb higher, that you reach out to those with that clout. And I think maybe the downside is that as women, maybe we don't feel as comfortable asking that, should we also be considered for this opportunity? Should we also even know about it? And sometimes that's where we are, again, out of the inner circle. Certain positions, certain opportunities may not be available to us because we simply don't know about them.
Well, I think that dovetails our last podcast, which was about imposter syndrome. And sometimes I think we feel we're not worthy or we're not good enough for the position. So I think as a symbiotic relationship, I agree, we need to feel empowered to think of ourselves in that way. And I think for our male counterparts, or even our female counterparts, not to see us as men or women, but see us for what the skill set is that we bring to the table, and what we can contribute to the field. Katie, I'm interested to hear what you think from the field of otolaryngology.
Sure. Just one thing that comes to mind based on the things that you mentioned is considering how we can give our sponsorship to other people, how we can ask for sponsorship, but how can we advance gender neutral sponsorship by thinking about the types of jobs or the types of opportunities that we give our trainees or mentees, and considering that women are more likely to be given a job that doesn't have advancement potential, a job that takes a lot of work but doesn't offer the opportunity to show skills at a higher level or for advancement, whereas men tend to be given jobs that are a little bit more ladder climbing. So as we advance in our career, thinking about how we can level a playing field and offer the job to the person that matches, whether their gender is male or female, and trying to make sure that we give opportunities where they can be given.
These gender neutral, sponsorships, and based on people's skill is what I'm hearing you say, but also based on people's career aspirations. Where do you want to go? It's not just what are your skills, but what do you want in your career? So let's think about the field of medicine and sponsorship. You've had the experience, all of you, as a learner, and then as a faculty member and as a surgeon. How else, Katie brought up a great point, how else can either we be sponsored or can we sponsor others early in their career? Because medicine is different than the world of insurance or technology or industry. So manufacturing, how else can we think about it in medicine?
Well, I think in my position, because I was given the great opportunity to become the surgeon in chief of Connecticut Children's. It did come by way of someone leaving that position that it opened up, and it was offered to me by the CEO of Connecticut Children's. He had a lot of faith in me and saw probably something that maybe as part of our imposter syndrome discussion, I didn't necessarily see, because when he offered me the job, I said I would take it in the interim until we found someone new. He asked me to just consider taking it permanently, and then we would work on it if it didn't necessarily work out for me. But he did start by asking what my career aspirations were, and what I thought I could bring to the institution. So I thought it was really done very well in that it was aligning my goals with what he thought the goals for the institution were. And he didn't see that I was male versus female. He saw me as just a person that was a general surgeon that could bring a skill set. And so I've taken that with me, and in looking at the great group that we have in the Department of Surgery, I've been very good at trying to mentor people and give advice, but taking those sponsorship opportunities and finding strategic committees, and I try to spread it across all the divisions, where I find people that I think would be well aligned for a certain strategic committee. So by strategic committee, I mean, committees that have board members on it, that have board seats, that actually make real decisions for the hospital, and really trying to promote individuals in their best capacity. That's how I look at it. And I think it's very important that we do it, and we try to do it fairly across all the different consortiums within the institution.
I think it's interesting how you mentioned that your first response to being sponsored was to hesitate, and I think I think that's what's interesting talking about mentorship and sponsorship is, I think all of us have talked in the past about this topic and talked about how we feel that sometimes there aren't as many sponsorship opportunities being given to women. But I wonder also is, how does this dovetail with our own imposter syndrome, and how often are we being offered sponsorship opportunities, but perhaps not recognizing them as sponsorship and perhaps not grabbing onto them? I think it's interesting. I made the rule when I took this job that I would spend 2 years saying yes to everything. And that was based on a lot of, just mentorship that I had, yes, from many males, who kind of said, you don't know where your career will take you. And your instinct might be to be overwhelmed by something or nervous about it. But just, to grab opportunities that you have them. And so I kind of made that rule and probably overcommitted myself a little bit. But I also think that it put me in the habit of having my automatic answer be yes. And then my second consideration, okay, and how am I going to figure that out? As opposed to, I think before making that rule for myself, my first thing was like, okay, how am I going to figure this out? Let me sort out the details before I say yes. And then I think turning that conversation around for 2 years has, I hope, helped me to move away from that and to just seize sponsorship opportunities that have been given to me, because they're not given often. And when that door opens, I feel like you get this window, you got to walk right through and grab it. And then for me, each little door that is opened has equaled a larger door afterwards.
Right. So it's almost like success begets success, that if a small window opens or small door opens and you go through and do it well, it can open larger or more significant doors.
Courtney, you bring up a really good point about transitioning from saying yes all the time. And I'm also in a yes period in my career where I say yes to everything. But I was able to see a really beautiful example of a mentorship sponsorship transition where I invited somebody to be on a panel that I was going to moderate. And he said, I'm overcommitted. I can't do it right now, but I have the perfect person for you. I will reach out to her. She has this qualification. She's going to be amazing. I'll sort it out for you. He reached out to this individual who's wonderful and, recruited her to do the panel with me. And I thought it was really an amazing example. It was really a mentoring opportunity for me to witness sponsorship.
I haven't had the experience where somebody has overtly sponsored somebody like that. I think that is beautiful, and it's something to know. Instead of him just telling you no, he really tried to help you out, but also to promote somebody else into a great, position, because it's always great to moderate a session and be a panelist. So that is a fantastic example.
Now let's transition and talk about a path forward. If we want to provide better sponsorship and receive better sponsorship, any ideas, or what ideas do you have for how can we help turn the tide so women in particular, women in medicine, women in surgery, can receive more opportunity so they can increase their influence and their positions of authority in an organization? Any ideas how we can increase women movement into those positions?
Well, one of the things that I've seen in the through the Pediatric Orthopedic Society and the American Academy of Orthopedic Surgery, in an effort to promote women, there was a time where people were realizing although there aren't proportionally as many women in the field, there was a disproportionate number going into research or doing some of these career young initiative to try to jumpstart a young career where there were opportunities. But all of these opportunities were in the first couple of years out of training. And somebody finally realized the reason, they're saying women aren't taking these opportunities, even though they're offered to everyone, they're not even applying. And someone had the brilliant idea, well, because they're only these couple of years, which is probably the time they're having kids. If these things could be delayed just a couple of years, amazing how many more women are now applying for them and doing them. And it just wasn't dawned on. So to have opportunities that might have to change a little based on age, which is a reality in women of childbearing years, that some societies didn't even think of until it was brought up. And it was a simple way to get more women applying for the positions if they could just wait a couple of years after. So it's a nice way to get your foot in the door. You get one of these roles or one of these fellowships or something. Now you're at the table with the big guns and you're starting to meet the people that you never would have had that opportunity if the rules had kept you at that age. restriction.
So, Kristen, what I'm hearing you say from that is we have to be willing to point out institutional or infrastructure injustices based on gender, so women can get a more level playing field, or get the opportunities that they should be that should be available to them. Thanks. What else?
I think what Courtney said was great. Said, start with a yes first. So if an opportunity arises, start by saying yes, and then try to figure out how you do it. And I think that will always put you at one of the first people that's asked, because if you're a yes person, people will come back to you and say, oh, this person was super easy to work with and very enthusiastic and wants to move ahead. So say yes.
Great. Another strategy. Thanks.
I really like the idea of using our own experiences to help promote change. So, for example, I recently found out that the ECGME training paradigm for congenital cardiac surgery fellowship now includes up to 6 weeks of maternity leave, which I was so excited to hear and see, because when I was going through the process, it wasn't there. Even going before that to general surgery years, I happened to have a male program director who was kind enough to point out that, for example, my firstborn was complicated, an emergency C-section, and had extended NICU stay. And if my male program director had not told me that based on the ECGME rules of extended leave, I would still be able to finish and get credit for my PGY 4 year by taking an extra 3 weeks or 2 weeks on top of the general 4 weeks of vacation, there is no way I would have known that. And by him allowing me to have that time with my child at that point, it showed me that, all it takes is the communication, the effort to want to change when you see a situation that's not right. But at the same time, you still need help from more senior faculty and those that are willing to see that this is not right. This is not normal. This is something that we need to change. And when you're able to garner support, and that support can lend itself to allow others to enter the field. And then again, it becomes gender neutral. It doesn't matter if you're a male or a female. It's the skills that you carry that should be able to get you into that position. And again, your age, your gender, and whether or not you're having children, barring you from the opportunity. If there's something we can do about that, that's, I think, a wonderful way.
But I think what I heard you say there, Raina, is that support for each other is imperative. And that's one of the strategies we can use to help not only mentor and sponsor each other, but to keep it as though we don't see the gender that's there, where it's, you help each other regardless of whether you're male or female.
And I think, cycling back to what Kristen had said, and that question that Lisa had about the awkwardness in the male-female relationships, I think that the more we have relationships that are based on something other than gender, the more we have relationships that are based on common interest in research or based on common clinical experience, and the more our interactions are based on those relationships as opposed to based on the gender that we carry, either male interactions or male-female interactions, and some of the stereotypes that come with that, the more we're treating everybody with a little bit more equity, if you will. I think the less that the male-female issue in mentorship and sponsorship is going to be a problem. Exactly as Kristen said, if everyone is treated, if sponsorship opportunities are sort of available to you regardless of your gender, and you're kind of raised up without concern for how gender might play a role, perhaps that will improve things.
Tonight, we had the opportunity to talk about mentors and sponsors. We understand that mentoring is really somebody sharing their expertise, but sponsorship is somebody really sharing their clout to promote your career. And both are important, but as women and women in surgery, it is crucial that women receive more sponsorship. You've identified some great ways for women to seek it or create it by identifying infrastructure or barriers and advocating for change, saying yes to the smaller opportunities and knocking the ball out of the park. So we keep saying yes and keep getting asked. Communicate what changes we see and need, and ask people to advocate for us. We talked about supporting each other, not just as mentors and sponsors, but just offering support to each other. And of course, looking for professional relationships that are based on a shared professional interest, shared goals, shared a passion about a particular aspect of the field. So those were all very helpful tips and ideas of how we can move this forward. So there you have it. There are our words of wisdom from our women in surgery. That's how they operate.
That's our show. Thank you for listening. Stay tuned for episode 3 as we bring women surgeons in to discuss what it takes to maintain a sense of wellness in a demanding career. Please make sure to rate, review, or subscribe to the Women in Surgery podcast on iTunes, Spotify, or Google Play.